Good afternoon. I'm going to start now the webinar, Theory Meets Practice, and I'm going to tell you a little bit more about the world of the first-line responders, the dentist. I'm starting with a welcome and introduction, followed by a recap. You have heard this already before, domestic violence and impact on health. Then continuing with recognizing the signs of domestic violence indicators, and then I'm going to explain to you what is special about dentists and why the dentists are very important frontline responders and what the red flags in the dentistry world. Then we continue with the communication in domestic violence, and then at the very end we're going to have a question and answer round. Well, about myself, I'm a physician and professor at medical school of University of Münster in Germany, and I have a strong focus on domestic violence and sex and gender sensitive medicine. Also, I'm an expert in medical education and how to teach things in general in medicine. And yeah, that's why I am the coordinator of VIPROM, this EU project. We just organizing this webinar, Victim Protection in Medicine. That's about me. So we start now with a first round of sharing your opinion. Please respond in the chat. And which medical professionals come to your mind first when you think of the first line responders to domestic violence? Just type in the chat your responses. Which medical professionals come to your mind? Okay, we got quite a few responses. For instance, general practitioners and nurses, triage nurses, family doctors, healthcare professionals in the emergency room, school psychologists, pediatrics, dentists and school nurses, pediatrician, clergy, pediatricians, emergency department nurses, and so on. Exactly. So psychologists, physicians, and we had, of course, had the very special focus on pediatrician and gynecology and so on. Of course, nurses, psychotherapists, paramedics, midwives. This had not been mentioned, but midwives, of course, are also first-line responders, and dentists. Exactly. And why are the dentists important frontline responders? First of all, patients come usually for routine checkups. So they come on a regular basis, and often, dentists know their patients because they come for many years. And also when they have children, the children also show up, and they know usually the family. Also, even perpetrator of domestic violence don't view dentists as a threat because they think, oh, well, dentists are not physicians. They're not real doctors. They don't really know anything about domestic violence. So my wife or my children, they can come because the dentists will not recognize any indicator or red flag. And also, what is very important, they have mean 30 to 60 minutes time when they treat patients as compared to mean 5 to 7 minutes when, for instance, a general practitioner is seeing a patient. So they have a lot more time actually with the patient and could observe, but also ask a screening question, for instance. And victims go more often to the dentist alone because many people really don't like going to dentists and not feel so comfortable, either sitting in this treatment chair or being in a room. So most of the time, victims go more often alone, and this is very good if you want to ask a question. And dentists often has the chance to see any injuries in the head area. Because, as I said, perpetrators don't view dentists as a threat. And in contrast to when you see a physician, many victims cancel their physician appointment if they had any head injuries or neck or face injuries, but they usually keep their dental appointments. So there is a unique chance for dentists to see any signs of domestic violence. We had this before, that domestic violence makes people ill and have a negative impact on health. Therefore, I'm just going not into details because we had this already in the first webinar. You know the various forms of domestic violence, and if you want to learn more, again, you can go to the first webinar on this topic. I just highlight 3 of these forms of domestic violence which can be seen by dentists. One is neglect, and I'm telling you later what neglect in dental care means. Then, of course, the physical violence, because they have a chance to see any signs of physical violence and bruises and lacerations, for instance. And also, they are in the unique position to see the indicators for sexual violence, for instance, in children. I will also let you know later why and how they are able to do that. So these 3 forms of domestic violence, which actually the most common forms, can also be detected by dentists. What are the victims of domestic violence? Again, you heard this before, just a short recap. Well, men, children, women, non-binary people, LGBTIQA+, people with disability, impairment, and mental illness, refugees and migrants, elderly and pregnant women. In short, everyone can be a victim of domestic violence. And this is the reason that you are going to have victims in your private practice as a dentist, as a physician, see it as a nurse, or whatever your background in the medical sector is. As I said, domestic violence has a negative health impact. And either you have some symptoms which are related to the direct consequence of being mistreated, or there is an emotional impact of domestic violence. And in short, as you know, domestic violence can affect a victim's physical and mental health. The general domestic violence indicators, which has been also shared with you in the webinar 3, for instance, is chronic conditions such as headaches, back pains, difficulty eating and sleeping, cardiologic symptoms without even evidence of cardiac disease. Then there is emotional distress, there is alcohol or substance abuse, prenatal depression when you're pregnant, and behavioral indicators. For instance, that patients have a constant change of doctors, a so-called doctor hopping, or they're ashamed about injuries or try to hide it. And also they react really nervous when they are being touched for some reason. So this is the general indicators. Now we come into the dentistry. So various studies report that injuries, if there is physical violence, occur mostly to the head, neck, and face area in 40 to 75% of all cases. And the reason is that this area is unprotected and therefore easy to reach. And also for the perpetrator, and you know, this is this balance of having somebody power upon someone else. And these injuries may also demonstrate the superiority of the perpetrator. So that's why they really also reach the face and do some harm. And what is also known in the scientific world, a woman who has to be treated for facial injury has 1 in 3 chance of being a victim of domestic violence. So that means if you are, for instance, a dentist and you have a patient with some injuries in their face, neck, or head, then there is a red flag or an indication that at least you should ask about domestic violence and the presence, because every third woman is a victim indeed. So I'm showing you now a video from the training platform of domestic violence, and it's about the possible indicators of domestic violence in the mouth and in the dental area.
What are possible indicators of domestic violence in the mouth and dental area? This is Sebastian. He experienced physical and psychological violence in his relationship for a long time. Back then, his dentist was the first who spoke to him about domestic violence. Even though Sebastian managed to escape the violence only years later, the conversation with his dentist was a door opener. But what are indicators of physical violence that can be recognized in the oral area by dentists? The affected areas are categorized into injuries of bones, soft tissues, and teeth. Let's start with injuries of the bones. Fractures can occur, for example, of the jaw, cheekbone, or the nose. Dislocations and injuries to the jaw joint can also result from violence. When taking X-rays, for instance, one should be attentive as previous traumas may be evident. The area that dentists look at most often are the teeth. The maxillary incisors are most commonly affected by traumatic injuries. For example, gaps, fractures, or dislocations may occur. Another indication that should raise increased attention is a generally poor dental status. Victims are often isolated from the outside world and may neglect dental appointments, leading to a potentially poor dental status. Psychosocial factors, such as increased stress due to violence, can lead to an elevated risk of periodontitis even at a young age. But sexualized violence can also be recognized in the mouth. For example, prolonged semen exposure in the mouth can lead to enamel erosion. Bulimia, which is defined by recurring episodes of eating extremely large amounts of food in a short time, and compensatory measures such as self-induced vomiting, also leads to enamel erosion. Bulimia can be triggered by sexual violence too. Now, let's address injuries of the soft tissues. Possible consequences of physical violence include a torn upper lip frenulum, petechial hemorrhages in the oral mucosa, and various inflammatory reactions. Sexual abuse can leave traces in the oral mucosa, such as abrasions of the palate and sexually transmitted diseases. Coming back to Sebastian's story, it becomes clear how crucial it is to be aware of the signs of domestic violence that can potentially manifest in the mouth and dental area. Only because his dentist was so attentive and trained to recognize all indicators, he could talk to his patient about this sensitive issue. Dentists are in a unique position to recognize domestic violence. Further information on domestic violence can be found on the European Training Platform.
So as you have seen, there are quite a unique opportunity to recognize various forms of domestic violence, like even sexual violence, because everything is shown in the mucosa of the cavity, of the oral cavity, and you can see quite a lot of things, how the teeth look like, and you can ask accordingly. So the first thing is, as a wrap up, you need to recognize. So you do anamnesis, some examination, then you check if there are any indication of injuries to the head, face, neck, and mouth. And the principles we talk about later is, of course, you create a safe environment to ask someone, ask clear and precise questions, and show empathy and do active listening. When you have addressed that and ask, there are several questions which may help you doing though. Is it important that you avoid some questions which may put the patients feel uncomfortable? But anyway, we recommend routinely asking about the cause of the injury. And you also have to mark down if the examination indicate experience of any violence, and also if there psychologically unusual behavior of the patient. We'll come to this in a bit. So when you have asked the patients after you assumed that there might be some domestic violence present, there are three ways the patient may respond to it. The first one is the patient denies having experienced any form of violence. Well, then you should still note it down that you have asked about it and that the patient denied. But you, of course, need to respect that the patient does not want to say anything or does not want to confirm that there is violence present. The next opportunity or possibility for you to intervene or to ask is that the patient confirms actually that she or he has experienced violence. However, they do not consent to the documentation, for instance, that you take a photograph. So you just have to use a forensic documentation sheet and then note this down, but you are not allowed to make any pictures or report it to anyone. And the optimal case is that the patient confirms that she or he has experienced violence and consents to the documentation. And then, of course, you can take pictures. The details and how to do so, you can watch in the previous webinar of this series on medical documentation. So I cannot go into detail here. Now we come to indicators in children in dentistry and indicators in general in children. And the focus is here on neglect, because neglect is the most common form of domestic violence in children. Now, please write in the chat some examples which come to your mind of child neglect in general. What do you think can be observed when a child is neglected at home? What can be seen? And yeah, what are possible indicators that a child is not well taken care of at home? Yeah, thank you. There have been quite some good examples. For instance, very thin child, dirty clothes, lack of hygiene, child left unattended for hours, they have caries on their teeth, they have a guarding posture, asking children to look after their other siblings at young age, poor diet, language problem, lack of bonding, emotional abuses, asking them to choose one parent, unresponsive in classroom or in play setting, not giving any eye contact, mildly disassociating when asked questions about home life, bones fractured, many and little injuries, interrelation, missing, neglecting hospital appointments, no lunch giving for school. Yes, the bone fractures are actually not a sign of neglect, however, a sign of physical injury. The others are really wonderful examples. And child neglect, and just to define, the neglecting persons can be persons with custody and those with a duty of care. And you usually know who is the person who is neglecting. So this is really different to sometimes other perpetrators, that in the case of child neglect, it's known who is the perpetrator. And as it has been mentioned in the chat, for instance, malnutrition and inadequate personal hygiene, inappropriate clothing, and also chronic state. So it's not once, it's happening over a longer period of time. And also persistent and repeated disregard of the child's emotional needs, deprivation of care, love, and security. And I just had recently a child who actually was neglected emotionally. And every time this child did something the mother didn't like, she didn't speak to this child for 3 to 4 days. And this child was really, really desperate. It asked something to his mom and she did not respond. And this is also emotional neglect. Now we come to a chart, to case study. And case study usually is a good tool to illustrate, how this can be shown in private practice or in the hospital or whatever. So this is a case study from the dental world. A little girl comes to your dental practice with her mother. She is about 5 years old. You notice that the girl, unlike most other girls her age, is very quiet and anxious. She is also much smaller and thinner. You also notice that the girl is wearing clothes that are clearly dirty. She also does poorly during your examination, and all of her existing milk teeth are severely damaged by decay. The girl tells you that some of her teeth hurt, and the mother states that the teeth have actually been darkly discolored for the whole time, for several years indeed. And that's, an example. And the question for you, you can please answer in the chat. What are the possible indicators that the little girl is neglected at home? So as examples, you have written her appearance and behaviors, state of the teeth, the girl is malnourished. Obviously, there is some emotional neglect in terms of love and care, and that the girl is anxious. Again, malnutrition, care of dental and physical hygiene in general. Exactly. So you see in this very telling case that, this girl, of course, has some signs of dental neglect. However, there are other indicators that there is general neglect happening for this little girl. And someone is writing in the chat, I have seen a child under 5 with all the milk teeth decaying. It's not just down to neglect or dental hygiene, but also very poor nutrition since birth. Yes, that of course can also be happening. But you see, so when you're a dentist, when you see something like that, it's very important that you not only see your teeth, but look at this entire little child and see, what do you see? How does it behave? How does he or she behaves when you touch her? What are the clothes the girl or the boy is wearing on, and so on. It's very important. So what we're speaking here is about dental neglect. And dental neglect, it's the persistent failure to meet a child's basic oral health needs